Bismillahirrahmanirrahim. In this video, we are going to talk about atropine. Atropine is an anticholinergic drug, and in order to understand its indications, where it is used, you should know what are cholinergic effects in the body, because atropine will have reverse actions of the cholinergic drugs or cholinergic neurotransmitters in the body. And the previous video was about the cholinergic effects in the body. So if you have seen that video, this video is going to be more easier and relatable to you. So let's begin with the indications of atropine first. I will just mention their names over here, and then one by one we will discuss these. First indication of atropine is that it is used to treat vaguely induced bradycardia. It is used for sinoatrial arrest. It is used in CPR, and it is used in the treatment of organophosphate toxicity, carbamate toxicity, blue-green algae, muscarinic mushrooms, muscarinic mushroom toxicities. Next we have is the contraindications of atropine, which includes tachyarrhythmia, because we know atropine increases the heart rate. So if the patient is already having tachyarrhythmias and you are giving him atropine, it will further increase the heart rate, and that is fatal for the animal. Next contraindication is alpha 2 agonist induced bradycardia. So we know atropine is used to deal with the bradycardia in the patient, but that bradycardia should be vaguely induced. But it should not be that bradycardia that is induced by injecting any alpha 2 agonist like xylazine, medetomidine, dexmedetomidine. So in the bradycardia that is caused by alpha 2 agonist, don't try to deal with that bradycardia with atropine. Rather, it is contraindicated because it will be fatal for animal. We will see that a bit later too. Next, ileus and GIT obstruction, because if the animal is already having GIT obstruction or ileus, atropine has a side effect in the body that it will also cause ileus. So if already there is ileus and you are giving the drug that will also cause ileus, so you are basically exaggerating that condition. Similarly, for urinary tract obstruction and in narrow angle glaucoma, you do not use atropine. We know glycopyrrolate is also an anticholinergic, belong to the same drug class as of atropine. So these are like sibling drugs, you can say. So, but the difference between glycopyrrolate as compared to atropine is that it does not crosses the blood-brain barrier. So glycopyrrolate is going to have less CNS effects, and atropine is going to have more CNS effects. Atropine effects on GIT is that it causes xerostomia, that is reduced saliva production, reduced tearing, reduced bronchial secretion. So it is a good choice for as a prenesthetic to be used with ketamine. If you are going to perform a surgery using ketamine, go for atropine as a prenesthetic, because it will deal with the side effects of ketamine. Ketamine side effects are like it increases the bronchial secretions, it increases the salivary secretion, and there is a risk of aspiration. So atropine will deal with them. Next is decreases GIT motility. So uh, um, GIT motility is if reduced, especially in horses, the atropine will cause ileus, and that is dangerous. So in using caution when you are using in horses. Also, it is used to dry the airway secretions, and used as a prenesthetic in the horses. Like I had, there is a this slide is a bit wrong. This statement ends over here. This is one statement and this is other statement. So it causes ileus in the horses, so using caution. And atropine is also used to dry airway secretions and used in anesthesia surgically in the horses. Next we have is in horses, atropine is used to treat bronchoconstriction because atropine will cause bronchodilation. And also it is used as pre-anesthetic even in horses with ketamine, but still you have to be very careful when using atropine with the horses, because after surgery, because of atropine, the horse is going to have ileus. It causes mydriasis, that is pupil dilation, for 3 days. Like in animals or even in humans, if you inject atropine, the effect of atropine on the eye will remain for 3 days. People will remain dilate, and when your pupil dilates, your vision gets blurry. So cats might like, if you have a surgery with a cat and you have used atropine, and after that if cats wakes up and stumbles on the things, so it means that cat is not having good vision, and that is because of this atropine. So if you are using, if the cat is undergoing multiple surgeries and she's having multiple injections of atropine, she may go permanently blind. So you have to be careful on this point too while using atropine. And you have to educate your owner too, that after surgery cat might stumble at home with doors or walls. So you don't have to worry, because within 3 days this effect will gradually uh, decline. So automatically a cat will start to seek things clearly. Next is the effects of atropine on the heart. That is, it is used in CPR to stimulate the heart. So, first, it is used in CPR to stimulate heart. Next, we have is it inhibits vagal effects on heart rate and causes increased heart rate and GIT, respiratory and salivary secretion. Basically, uh, uh, if there is the decrease in heart rate, that is bradycardia, but vagally induced, you can use atropine to increase the heart rate. But it also has effects on GIT, respiratory and salivary secretions, and that effect is of reduced motility, reduced respiratory secretions, and reduced salivary secretions. uh, Again, here, this box is important, that atropine is used to increase the heart rate, but that should be vaguely induced bradycardia indication. But if the indication is of alpha 2 induced bradycardia, you should not use atropine. Remember that, because it is contraindicated for reflex bradycardia seen with xylazine or at dexmedetomidine or medetomidine in cats and dogs. And why is that? Let's see the reason. When you talk about atropine, it blocks parasympathetic tone in heart, which causes increase in heart rate. But if you talk about alpha 2 agonists, they cause vasoconstriction. This vasoconstriction will cause increased blood pressure. Basically, alpha 2 agonists increase the blood pressure by causing vasoconstriction. So with that, heart rate will automatically slow down, so that to compensate that high blood pressure and increase systemic vascular resistance. So basically, this decrease in heart rate to respond the high blood pressure in the body is called as reflex bradycardia or baroreceptor response. So basically, this is the cardiovascular system striving to keep the blood pressure within normal range. So you can see the way alpha 2 agonists are causing bradycardia, and the way atropine is causing increase in heart rate, the pathways are different. So you do not use atropine to deal with the bradycardia that is caused by alpha 2 agonists. Rather, it is contraindicated. So you should remember this point. And the last thing that we talked in the previous slide about these indications that atropine is used in the treatment of these toxicities. What about these toxicities? That organophosphate, carbamate, blue-green algae, or muscarinic mushrooms, all of their effects are just like cholinergic effects. So you can use atropine an anticholinergic drug to be their antidote. So it will be helpful in protecting the animal. That was all about atropine. I hope you have understood this. Thank you.